Hello, I'm Roxanne DePaul, and my presentation is on workplace violence in the healthcare setting and how nursing staff can learn to manage and de-escalate these behaviors. My practicum setting was Select Specialty Hospital, where I'm currently employed. I've been there for the last 16 years. Select Specialty is known as a long-term acute care hospital, or an LTAC. Select their healthcare facilities for patients that need an extended period to recover following their initial hospitalization. Most of our patients come from ICU or CCU and require additional vent weaning, longer antibiotic therapies. Patients here require a high degree of advanced medical care provided by doctors, nurses, and other clinicians, care that cannot be provided by a skilled nursing home or home health. My goal was to assess the nursing staff's knowledge of what constitutes workplace violence and patient care, to create educational materials to present to the nursing staff for education on workplace violence, and determine if they can identify high-risk situations when they're in them, clearly define what workplace violence is, and enable the staff to recognize and react appropriately to ensure their safety and the safety of the patients. Objectives for the project were to identify what workplace violence is and the statistics of prevalence, identify 4 patient behavioral changes that can assist nursing staff in identifying high-risk situations, and to discuss with nursing staff what interventions are necessary to de-escalate a violent situation. What is workplace violence? The CDC, National Institute for Occupational Safety and Health, defines workplace violence as violent acts, including physical assaults and threats of assaults, directed toward persons at work or on duty. The U.S. Department of Labor defines workplace violence as an action, verbal, written, or physical aggression, which is intended to control or cause, or is capable of causing death or serious bodily injury to oneself or others. Workplace violence includes abusive behavior towards authority, intimidating or harassing behavior, and threats. Occupational violence has been defined as the infliction or threat or harm or injury, either physical or psychological, upon another person in the course of their professional responsibilities. It includes verbal abuse, threats, or intimidating behavior, and intentional physical attacks. Discuss how I accomplished my objectives, I'd like to discuss statistics in America. According to the Occupational Safety and Health Administration, approximately 75% of nearly 25,000 workplace assaults reported annually occurred in healthcare and social service settings. Workers in healthcare settings are 4 times more likely to be victimized than workers in private industry. The Joint Commission in 2018 stated that healthcare workers have a 20% higher chance of being the victim of workplace violence than others, and that only 30% of nurses report incidents of workplace violence due to thinking that violence is just part of the job. Healthcare workers are 5 times more likely to be victims of non-fatal assaults than any other profession, nearly equal to that of every other industry combined. The statistics are frightening. When I was searching for a project topic, I was trying to think of issues that were personal to myself. What did I struggle with at times? What did my colleagues struggle with at times? What were the major changes that I've seen over the course of the last 16 years? One of the major changes that I noticed were the patient demographic. Changing demographics. At Select Specialty Hospital, the demographic has changed from that of the elderly to a more younger population. Years ago, most of our patients were elderly, suffering from various conditions related to poor cardiac or respiratory functioning. In the last 5 years, our patient demographic began to shift to a different kind of patient. We began admitting patients that needed long-term antibiotics related mostly to septic emboli endocarditis, type infections from IV heroin abuse. Behavioral issues with these patients became more and more difficult for our staff to manage. At Select, we had no formal training on how to handle angry, aggressive patients and their families. We had no training to teach us how to de-escalate violent situations. We had training that focused on staff behaviors, but not anything that focused on this new type of patient that we were encountering. One of the first things that I did at the facility was to make a handout and give to the nurses and discuss 4 patient behavioral changes that can assist nursing staff to identify high-risk situations. The first one being patient exhibits irrational or bad attitudes, displaying a demanding, dissatisfied, unhappy, angry, distressed, or frustrated demeanor. The second, patients who make inappropriate eye contact, including glaring or staring. Patients who use inappropriate tones of voice, for example, in a demeaning or sarcastic manner. And lastly, patients who intimidated via the use of threatening language or clenched fists. I developed 10 de-escalation tips to help you respond to difficult patient behaviors in the healthcare setting. I created a pamphlet and handed it out among the staff. And had a list of 10 different things that could be done and employed to have more positive outcomes. Be empathetic and non-judgmental to the patient. Try to understand where they were coming from, why they were angry. Respect personal space. Never get too close to the patient. Never lock yourself up in a room with a patient just to, protect yourself and them, and to avoid giving them unnecessary anxiety. Use non-threatening nonverbals, words that would intimidate, harsh words that would cause them to act out more aggressively. Avoid overreacting. Many of the staff knew that they couldn't argue with a patient, but they didn't know how to not bristle when encountering situations like that. To remain calm, to keep your perspective. That was an idea, a goal that I wanted to process with them. To focus on the feeling behind the anger. Why are they acting the way they do? Why are they upset? Don't focus as much on what they were doing specifically, but why were they? If you got to the point where you could find out what was the true basis of their anger, that was something that you could focus on and work with. When they would challenge you with questions that you couldn't answer, never say things like, I don't know what to tell you, or I can't help you, or settle down. Things like that were not popular choices to say. What really they needed to hear was, I don't know, but I'll find out. I'll do whatever I can to make this work. We'll figure it out together. Most importantly, setting limits. Many times I saw staff arguing with patients, being like children, back and forth between each other. What they needed to learn was to set limits, set specific behavioral boundaries, and stick to it. I will not listen to this type of verbal abuse. I'll come back later when you're more ready to listen. If you do not de-escalate these situations, they can grow and become bigger problems. Choose wisely what you insist upon was another tip. Don't always follow the rules so stringently that you cannot see beyond them. Obviously, rules and boundaries are set for protection of the staff and the patient, but there are times when you can, with the CEO or CNO permission, bend the rules to accommodate. It can go a long way with making a patient more agreeable. And allow for silence and reflection. Not every incident had to be resolved at the moment it was occurring. Sometimes stepping back and letting the patient, reflect on what you discussed was always, was an option that should be used, especially when it's a highly aggressive situation. And then to never demand that there is a decision immediately. Always allow time for decisions to occur. The patients needed time to process at times what we were trying to do for them, and also, what they wanted to do for themselves. Another piece of educational material I handed out to the staff was scenario testing. I handed out tests that had 6 different high-risk patient situations. The staff chose from 4 multiple-choice answers. I gathered those over a course of a week and then looked at the answers. Interestingly enough, 15 tests were obtained. Only 5 had the correct answers to all of them. The other 10 had an average score of 75%. After having meetings with the staff over the test results and the educational material, staff felt there was not enough employer education regarding violent or aggressive patient encounters. Most of our educational material provided by Select was how to handle bad behavior by staff, not the patients. Best practices on how we handle violent patient behaviors need to catch up with the changing times. With the patient demographic shift towards younger individuals with drug-related issues, corporate must create a new way to educate the nursing staff on aggressive patient behavior. What I'd like to see corporate develop is a best practice on patient de-escalation. That being said, offer educational material that would ensure the safety of the patient, staff, and others in the area, help the patient manage his emotions and distress, and maintain or regain control of his behavior, avoid the use of restraint when at all possible, and avoid coercive interventions that escalate agitation. It is time to change how we view safety in a healthcare setting. We need to keep our patients and ourselves safe. This education on de-escalation is very personal to me. Over the course of the years, I've seen many nurses be injured from patients. I had witnessed a patient strangle a nurse. I had witnessed a patient assault one of the security officers. I had seen many situations of my own where I could have been in danger, where I wasn't taking my own safety into consideration. Over the last several years, I've encountered more and more situations that could have resulted in my own injury or the injury of others. As nurses, we need to be more aware of our surroundings and how our behavior affects patient behavior. We need to be aware of where we're speaking to the patient, how we're speaking to the patient, what could be a negative effect of what we do and how we do it. Most of the nurses I have worked with in the past and now have only basic skills to de-escalate violent situations. Much of what I have learned over the years, I've learned by trial and error. Not the best way to do it. Healthcare workers must receive proper training and education on necessary foundational behaviors related to recognition and communication skills and verbal de-escalation. That training needs to be updated and given yearly to keep the staff on top of the changing climates in healthcare setting. In our Select Specialty Hospital, because of where it's located, the demographic has shifted to more IV drug, heroin abuse type patients. They're dangerous when confronted in a wrong manner. There is so much to learn. There are so many areas where the staff could learn to use safety measures. Very, very important in our healthcare setting to be safe and to keep the patients safe as well.